A Norwalk Hospital orthopedic surgeon and his team continually help impoverished children with complex spinal conditions on the island of Jamaica.
And I'd like to quote him directly. He says, "The most rewarding aspect of this mission is that not only do we change the lives of our patients and their families, but our own lives are forever enriched." You'll meet this remarkable man and hear about his activities on this week's Health Talk. We're up next.
Hello, I'm Dr. Vicki Smitak.
And I'm Dr. Eric Mazer. Today we're going to talk about scoliosis and some work both in this country and in Jamaica with Dr. Robert Brady. He's an orthopedic surgeon with Coastal Orthopaedics. Rob, welcome back to the show.
Thank you.
Welcome. It's nice to have you, Rob.
Thank you.
Now, orthopedics is a very wide field.
Sure.
What got you interested in spinal disorders in particular? Tell us a little bit about your background there.
Yeah, I think that my first love of spine surgery came from experience that I had with the surgeries itself and its techniques. I thought that the surgeries were exciting to me, and then spinal deformity in particular. I think that as I went through my training, children really they have no other alternative motive but to get better and get back to their lives. And I think when you do and you go and you correct their deformities and they're happy and they heal well, I mean, there's no better feeling than operating on these children.
And these are surgeries that are largely performed on children, adolescents, not in older individuals, correct?
Correct. I mean, most scoliosis surgeries are performed on children, adolescents, sometimes infants. Scoliosis surgery in adults is a much different type of surgery.
I would
Can
imagine.
you say just a couple words for our viewers what scoliosis is? I think
Sure.
most of us know, but a lot of people there may not realize what it is and
Sure.
what causes it.
Yeah, scoliosis is basically a curvature of the spine. Oftentimes we don't know why the scoliosis curvature happens. There's a condition called idiopathic, which means we don't know why.
Yeah. A fancy word that means we don't know.
Right.
Exactly. We know a couple things. One, we know there's some genetic basis to it, and then we know that it progresses during periods of growth predominantly. So, adolescence is the most important time to catch it, monitor it, and to correct it if need be. Otherwise, as they grow up to adults, and if it gets pretty severe, that can be pretty debilitating.
Yeah, isn't the Hunchback of Notre Dame? Isn't that
Right.
sort of the extreme of?
Exactly. We try not to be we try to be more politically correct and not call it a hunchback anymore. But
Yeah.
that's
But
it.
it's also, it's not only disfiguring, but it
Yeah.
also poses health problems, right? Respiratory compromise.
Correct.
Because they can't breathe as well as if they had a straight back. What other
Sure. I
medical
mean,
issues?
everybody sees the cosmetic deformity that's pretty obvious. However, as you stated, when the curves get more than 70 to 80 degrees, it can compromise their respiratory system, their lungs, their heart. When the curves get more than 90 degrees, then it affects their mortality, meaning the age of when they die, because it can be pretty devastating disease.
Sure.
And the physical deformity creates a real psychological consequence, doesn't it?
Absolutely. I mean, and that's something that as physicians I don't think we get quite a handle on. But the psychological aspect of scoliosis, and especially during adolescence when it's a hard time in and of itself, and then you add on that a deformity, it can be a very difficult time for these children. And then as adults, clearly, body image is a very big thing in the
Sure.
United
Yeah.
States, so it can have
And
significant
we had
impact.
talked before the show, and we said during the introduction that you not only do this here in Fairfield County at Norwalk, but you also have set up a foundation, the Straight Caribbean Spine Foundation.
Correct.
I got
Yeah.
the words right. That
You did a good job.
In 2006,
Yeah.
where you go back to Jamaica twice a year
Yeah.
and do this for children. Could you say a little bit about how you decided to do this? I think
Sure.
it's a really, truly remarkable undertaking, and what you've achieved is amazing.
Well, thank you. I think that going through my training against scoliosis, really was a passion for me, because I loved doing it. I loved operating on the kids and seeing the effect that they had on their lives. And then when I finished medical school, both my parents were in healthcare. My dad is a surgeon, my mother is a nurse. They implored that I give back, and both of them being from Jamaica, it just made sense that I would go back to Jamaica and try to create something there. And I had the fortunate pleasure of having, many connections and people that I had access to that allowed me to create this foundation where we go twice a year and we screen kids, we operate on kids with very severe spinal deformities because they don't really, there's very few surgeons on the island that do this, and certainly not to the extent to this deformity that they have.
No, you've certainly given back, Robert. I think we have a video actually that we'd love to show of the work that you do in Jamaica, and I think
Let's
that's
bring that up because I think this is one of a grateful patient who made this video.
Yeah, this is a phenomenal video. This is one of my patients who was a film producer. I operated on 6 months prior to shooting this video, and he wanted to give back to me and to changing his life, and he came and he shot this amazing video, him and his cameraman, and I'm really proud of it.
Great.
So we're going to bring this video up, and so our viewers can see it as well.
Awesome. When I got through medical school, I made a promise to my parents that I was going to come back and I was going to do some not only good things with my life, but I'm going to do good. I have a passion treating scoliosis, and it just made sense for me to come back to Jamaica and do that here. Bend forward for me, sweetie. Bend, 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 bend. Bend, 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 bend. Good.
1 out of every 7 children has scoliosis. It's a little more common in African American children, and so in this country there's more of it, and they don't have anybody who can take care of that when surgery is needed.
Our goal, I think, is to try to get her surgery done on this trip. We just have to fuse the major portion of where the curve is. The screening process here doesn't mean much because they don't have the access to bracing. Prioritizing the children is probably the most difficult portion of the trip. All these kids need surgery, but not all of them can have surgery at that point.
All of these surgeries are emotional in the sense that you go into it with a different mindset. These kids have one chance. They're never going to get to see an American doctor. They're never going to get to have this surgery performed unless we come down here. And so for me, this is the chance of their lifetime for their disease process.
To date, the mission has operated on over 100 patients over the last 8 years. The surgeries themselves can cost over $10,000 to $20,000. You add on the anesthesia costs, the hospital costs. Sometimes they need to go to the intensive care unit. The implants alone can cost up to $50,000 to $60,000.
To have the equipment donated and the time donated and the hospital care donated is certainly huge for these kids, because certainly they could never pay for it. Most American kids, even affluent kids, couldn't pay out-of-pocket cash for a surgery like this.
Scoliosis is a condition that has a lot of stigma associated with it. You know, these kids don't feel great about themselves, and then when you do and you correct them and they're straight and their deformity's gone, it changes their outlook on life, how people interpret them, how they interpret themselves. The best part of it is when I come back and I see these kids. Now they're my friends, you know, they're slapping me high fives, they're hugging me. The feelings that I get from doing this trip and I reflect on the trip and reflect on the people that I've met and the surgeries we've done, you know, oftentimes I'll just cry because it becomes overwhelming.
We really changed their lives and really influenced the country of Jamaica, one child at a time.
Rob, that was a very moving video, and that is just amazing work that you do.
Yeah.
Thank you.
How long are these surgeries?
The typical surgery is anywhere from 2 to 4 or 5 hours. So, and sometimes we require multiple surgeries on some of our patients with the more severe deformities.
I would imagine some of the patients we saw had some pretty impressive curvatures.
Yeah.
Now this is because, as you mentioned earlier, there really aren't maybe good screening programs in place, and also not enough surgical resources.
Correct.
You said. What
Yeah.
about bracing? Are these children? Do they have access to
Right.
bracing?
Yeah, there's really not much access to bracing. I think there's one, and I've met her. There's one person on the island that makes braces.
I see.
But it's really a cost thing, Vicki. The kids don't have the money to spend on the braces. They don't have the money to do the surgery, certainly.
Right.
Oftentimes, when they come to our clinic, this is the only clinic that they'll come because it's free. Although they have national health care, it's not really instituted very well there. It's a third world country.
And as we discussed earlier, this really is transformational in the kids' lives. It changes their body image, it changes their future. It's really a way of affecting them at the most profound level.
Right.
Are there kids that stand out in your mind for the experience you've had with this video?
Sure, I mean, they all do.
And you've done over 100 kids, right?
Right. What's great about it is that most all these kids, when you see them and you tell them that you're going to do surgery on them, if I do that in the States, it's there's a lot of tears and they're very upset. They're happy, they're anxious because they want to get better, and so they understand that this is their chance.
Mm-hmm.
But there's the two girls that you saw at the end of the video. They're twins. They both have this condition called neurofibromatosis, which is a disorder of the nerves where it causes benign tumors, but it also causes a significant curvature. And one of the twins I operated on 4 or 5 times, where trying to correct her 180-degree curvature. She had an injury to her spinal cord, where she was virtually paralyzed after one of the procedures, which she regained her function, fortunately. But she's now 18. She's doing excellent. She's actually planning on going to cooking school. So she's been a very special person in my life.
And you
for the
stay in
last 5
touch with
years.
these kids, don't you?
Oh yeah, absolutely.
Do you also see them for follow-up? So after you perform the surgery, what's the frequency of your interaction with them afterwards?
So we go down twice a year, so every 6 months. So usually I see them every 6 months. If they have problems, we have a pediatrician there in Jamaica that will see the patients. Oftentimes they'll email me or send me messages if they're having problems, or just to follow up and say
So
hi.
you really stay actively involved.
Yeah.
I think that's a really important point to make. I mean,
Yeah.
it's not like you just go there, you do the surgeries, you come back,
Yeah.
and then you go again next year. You really stay in touch with these patients and families.
I think it's imperative
That's really commendable.
when you're doing this type of surgery, where it's big surgery, it's dangerous surgery.
Sure.
It's not something that you can go and leave and never talk to these people again. You have to follow up on them. It's imperative because things can happen post-operatively that you have to be aware of as well.
Well,
Absolutely.
I really admire your work, Rob, and it's really, again, sort of striking the difference that you can make in people's lives in such a profound way. We're going to take a short break, but we'll be back in just a few moments. Hi, we're back with Dr. Robert Brady. We're talking about scoliosis, some of the great work you've done down in Jamaica. It's just spectacular.
Thank you.
It
Thank
really
you.
is, Rob. So there must be a lot of philanthropy. I think you started to talk about that a little bit in the earlier segment.
Yeah, this
in order
is
to
a
make these
big
surgeries
deal.
happen.
These, these surgeries are tens of thousands of
Yeah.
dollars worth of. I know you donate your services, so
Sure.
but you have to. This stuff costs a lot of money.
Yeah, I mean, I think for me, again, I love curing the back pain of Fairfield County, which is what I do here, but I don't think I would be able to do it if I didn't go and do these missions twice a year, because it really, for me, it brings back, why I went into medicine, which is to take care of people. You're right, the foundation itself is, getting there twice a year, even just the cost of travel, it's pretty expensive for each person. It's about $2,500 per person.
How large is the team you bring down?
Usually, the team is usually ended up from 10 to 12 people, including other doctors, nurses, surgical technicians. We bring down neural monitors, patients, these guys who monitor the nerves during the procedure. The implant representatives. So our team is usually about 10 to 12. We talked about the implants themselves are extremely expensive, and that's really the big roadblock for getting these procedures done there. Currently, is the cost of the implants, and so
those are
currently,
donated then?
Globus Medical is our big donate, kind of our product donator, and they donate all the products.
That's terrific.
They ship them over there.
Do you get local philanthropy as well?
I do get a couple. I do a couple local fundraisers. Norwalk Hospital certainly has helped. We have one of the OR nurses that comes down with me twice a year. There's been some other philanthropy from other foundations.
So if somebody wanted to donate, is there a specific website or that
Yeah.
they could go to?
Yeah, absolutely. There's the Straight Caribbean Spine Foundation.org.
Okay.
And so they can go on the website
And that's
they can
all
certainly donate.
put together as one word, straightcaribbeanspinefoundation.org.
Correct.
Okay,
Yeah.
so if
Okay,
anybody
that's good for our
who's
viewers
out
to
there
know.
who wants to
Yeah.
donate to this extraordinarily worthy cause,
Yeah.
they can do that.
I welcome it.
Yes, I'm sure. I can't imagine putting all of this
Yeah.
together, the logistics of just getting the materials and
Yeah.
the people and making this happen.
It's a lot, but I have a tremendous amount of help and support. My wife herself, who she had no background in this, is really, she helps to coordinate the missions. My children have been on the missions, and they've helped in the clinics.
What a great thing for your children to be a part of.
Oh yeah, absolutely.
What a message to send to
That
your
really
children.
is wonderful. Now, in addition to the work that you do in Jamaica, you do a lot of this work locally, as we started saying, and you run a scoliosis clinic at Norwalk Hospital, for
Correct.
example. Let's talk a little bit about that. Let's kind of bring us home for a little bit.
Sure.
And tell us how that's going, how that started.
Yeah, I mean, I've been at Norwalk Hospital about 8 years, and we've been really trying to develop the scoliosis program there. Prior to me coming, we did a lot of screening, but we didn't do the surgeries there.
Right.
But I think that the program that we have there and the team, the surgical team that we've built, especially in the pediatric department, has been really supportive. And I think we have an excellent program that we can take care of these kids, even with the kids that have a little bit more severe deformities. We have a pediatric anesthesiologist who's very good. The ICU has been very receptive to the adolescents that we've had to operate on them. So I think it's a great program. We're trying to expand it, trying to bring in more of the kids into this area, so they don't have to be referred 50 minutes north and 40 minutes south for good care. They can stay here in Fairfield County and be taken care of.
Right, because the expertise really resides here. It sounds like, I mean, from everything we've seen in the video, and from knowing you for as many years as I do, we have some really high quality spine resources right here in our backyard.
Do the pediatricians, I'm going to express my ignorance, do pediatricians routinely screen the kids for scoliosis? Or if a parent's worried, should they do something specifically? We've got parents at home, I'm sure,
I mean,
that are concerned about this.
There's a couple resources. One is most of the schools institute a screening program, so usually around fifth to sixth grade, they'll screen the kids where they'll bend them over. Sometimes they'll have a scoliometer, which measures whether there's any rotation or asymmetry. And so I get a lot of referrals from the school programs and as well as the pediatricians. And the pediatricians are usually pretty good, and they know when they start to see something. If it's something minimal, they'll keep an eye on it, but if there's something a little bit more concerning, they'll send it to me. We'll get a baseline x-ray. 80 to 85% of the time, we're just monitoring
I was
these
just going to
children.
ask that. Scoliosis doesn't automatically mean they need the surgery.
Yeah.
Or even a brace. It
Yeah.
may just mean that it'll sort of correct itself as the
Exactly.
child grows. Is that right?
Exactly.
Do
I mean-
exercises or anything like that help strengthening
Yeah, I mean the
core
majority.
muscles? Or
Again, the majority of the time we're just keeping an eye on these kids. Probably about 10% of the time do we need to brace, and 4 to 5% of the time do we need surgery. There's only really two, and those are really only two treatment options. As you talked about, exercise, physical therapy, chiropractors. There's nothing that's going to change the natural history of these curvatures besides the bracing
and
or
this is
surgery.
largely genetic, or it's not nothing people do. It's not a lifestyle issue.
Right.
You're sort of born with it. It may or may not be inherited, but it's congenital.
Correct. So, there's the most common type of scoliosis, so there's different types of scoliosis. Most common is idiopathic, and as we talked about before, that means we don't know why. But the genetics is a big part of it, and we know that it progresses during periods of growth, so that's the most important time to catch it, monitor it.
And that's really when the pediatrician's role is most critical, and the parents as well, because you see those children when they're referred to you, but somebody has
So
to
this is a
actually be vigilant and pick it up.
Yeah,
So
absolutely.
the important thing is to take your child regularly to a pediatrician who
Sure.
can
Yeah.
monitor this, and it
Yeah.
sounds like the schools are certainly alerted to this
Right.
problem as well.
I mean, I usually see, if I see something, some curve, I usually see them every 6 months to a year, just depending on the magnitude. But like I said, the majority of the time, we're just keeping an eye on them.
So we don't want to frighten people too much, but on the
Yeah.
other
Right.
hand, this is something that can be dealt with. So it's
Yeah.
a really important thing. And of course, it can be devastating left untreated, as
Sure.
we've seen in those children. I want to thank you for being our guest and the wonderful work that you do.
Thank
When
you.
we come back, we're going to actually keep Rob here, and he will help us answer today's health question.
Right now, let's take a look at some of these messages from our sponsors. This week's health question is, what is a slip disc?
What is a slip? Everybody seems to have a slip disc.
Yeah.
And
have the perfect
And we have the
individual here.
perfect guest to answer that question. What is a slip disc?
This is probably one of the most common things that I do see, in our adult kind of degenerative conditions. So slip disc is typically the most generic term is what we call sciatica. So basically, a slip disc. The disc is the cartilage in between the vertebra, and it's held in by a ligament. And so that ligament sometimes can tear from the degenerative process. And when that ligament tears, that allows that disc to herniate or slip out. And usually where it slips out is onto the nerve. And that's what causes that sciatica, which is the pain going down from your buttocks down to your leg, sometimes numbness, tingling, weakness. So that's
And they're
what we
pretty
refer
common,
to.
aren't they, as we get older? We say degenerative. It's really wear and tear. We live
Yeah.
older, and they're pretty common, aren't they?
Yeah, I don't know why they call it a degenerative disc disease, because it does happen to us all to a certain extent, but this is pretty common, and it's usually slip discs are fairly benign. Its prognosis.
Does it happen from injuries or from exercise, or is this more, as we said, a degenerative process that happens with wear and tear and with age?
It can come from both. There are patients who come in and they said they've done nothing and they have the symptoms, and then patients who come in and they've done CrossFit and they do a deadlift and then they come in with tremendous amount of pain.
Yeah.
So it can come from either way.
And the correction for this is always surgery, sometimes surgery, never surgery?
I think 90% of the times it will go away without us doing anything.
Okay.
Sometimes we need to do treatment like medications, anti-inflammatories, steroids, therapy. Sometimes we do injections, and then those ones that don't get better, or they have a lot of pain, or if they have a neurologic deficit, then we do surgery.
I think
Thank
it's
you,
very,
Robert.
very helpful. Thank you
That
so
is.
much. I'm glad I didn't have to answer that. But if you have a question you'd like to ask on Health Talk, please contact Vicki and me at healthtalk@oralhealth.org.
We would like to thank our guest today, Dr. Robert Brady, for coming on our show, and see you next week on Health Talk.
Bye-bye.